Welcome, everyone. It's a pleasure to be here with you. And tonight I want to talk about actually headaches and neck pain, mainly due to computer use, but there are other reasons for having headaches and neck pain as well. And then at the end, I'm going to show you some acupressure points. They are same acupuncture points that I do in my practice, but you will be able to actually use these points to help if you have a headache or someone in your family has a headache or a friend. So let's start. There are many kinds of headaches, and probably migraine headaches are the ones that are the worst headaches. Those usually come on one side or the other and last for a few days. There's also tension headaches that are like a band around your head, cervicogenic headaches that come up the back of the neck and have tight neck and shoulders. There's headaches, sinus headaches due to allergies. So there's many reasons for headaches. So tonight I'm going to first we're going to talk about habits that can cause headaches and habits that we can develop so we won't either get headaches or help us, if we do have headaches, help prevent them from coming. So the first habit I want to talk about, and I think it's one of the most important things related to headaches, is called hydration. Most people get headaches because they don't drink enough water. Now, that sounds like the simplest, easiest thing, but it's really true. When we're dehydrated, it's not good for our muscles, it's not good for our brain, and many headaches, the main cause is dehydration. I know myself in my clinic, I work with patients all day and I'm talking and busy, and sometimes I forget to drink too. And I can just feel this little headache in the back of my head starting to creep up, and I go, oh, better go drink something. So water is one of the most important things to drink, but it's also important for our hydration to, if you're headache prone, to add electrolytes to the water. Now, electrolytes are sodium, potassium, calcium, magnesium. And I know here in India in the pharmacies that you can buy them in the little electrolyte packages. And especially as the weather gets warmer, it's important to add those to your water. And the sodium and potassium ions, they exchange places. And if we don't have that enough of them in our system, they're not exchanging and they're stuck, and that causes tension in the muscles. The same is true for calcium and magnesium. And magnesium is probably the most important electrolyte because without it, we have a lot of muscle tension. So some people just take magnesium tablets, and that if they have a headache and their headache goes away. So just make sure that you're hydrated, and as the weather gets warmer, put the electrolytes into your water. Now, the second thing I want to talk about is the computer. And everybody these days is on the computer. It's just whether at work or home or your phone, but some sort of computer. And with the computer, ergonomics is most important. So it's most important to have your computer at least 18 inches to 2 feet away. Now, and you want to have your computer so that your eyes are looking straight into the computer. And that's most important, because if you're looking up or down or to the side, that's going to cause tension in your muscles. So you either need to elevate your chair or to elevate the computer, just so that you have a direct look, that it's you're just right looking into the computer. And the smaller your device gets, the more strain it has on your eyes and the more potential for headaches. So say you're looking at your iPhone and you have it here and you're looking down, well, your eyes are actually looking a little crossed as it looks at your phone. So it's most important to even keep your iPhone at a certain distance. I my phone updated, I guess, one of its systems. And lately, my phone is, I'm having it here, and it's saying eyes too close. And it won't, and I have to pull my phone away before it lets me continue. And I just realized I have a bad habit of keeping it right here, looking at it. So maybe I have to buy a new one and get a bigger one. But it's interesting. I was surprised that now the phone is telling you if your eyes are too close. But if you're at the office and you're working all day and you're not looking straight at the computer, it's just it's a potential for a headache or neck pain. And so when we're looking at the computer and working all day, we only blink 4 times a minute. Now, when you're outdoors and you're taking a walk, you'll be blinking 12 times a minute. So there's a lot of eye strain that goes on when we're with the computer. Eye strain can also cause headaches and also can, wreck your vision. There's even a new kind of glaucoma that comes from eye strain. So it's really important to have good computer ergonomics. And next, I want to talk about some supplements and some diet and things that you should and should not do. So there's certain, not really foods, but additives to foods that we should stay away with if we're headache prone. Number one is red dye. Anything that's really red and full of dye, if you're prone to headaches, you shouldn't have it. And the other is any of the unnatural sugars, the artificial sweeteners, and especially aspartame. Any of those are not good. NutraSweet. Stay away from those. It's much better to have honey or just regular sugar. I had a patient who had migraine headaches, and he was coming for a few weeks, and the headaches weren't getting better. So I started asking him about his diet. And he told me his diet. And then he said, well, every day I eat yogurt for lunch. And then a couple hours later, seems like my headache starts. So I asked him about his yogurt, and it had the NutraSweet in it, the artificial sweetener. And I had him stop the yogurt. And he came back the next week and he said his migraine headaches were gone. Now, usually it's not that easy, but it was just a reminder that all those artificial sugars are really not good for you. And I say, if the ants don't eat it, we shouldn't eat it either. So there are a few other things. For some people, even chocolate can cause migraine headaches, or aged cheese or cured meats. In America, hot dogs are popular. Of course, I'm a vegetarian, but you don't want to eat those things. Those can also cause headaches. So headaches usually come with inflammation, and there are some natural products that are have anti-inflammatory properties. One of the most important is turmeric, and I know in Indian cooking, there's the use of turmeric, which is excellent. It's especially good to cook with it. And for turmeric to work, it needs to be with some oil and pepper. And if you put it with, say, coconut oil and you cook with it, the bioavailability of the turmeric is 2,000 times greater. So it can get into your system. So it can have anti-inflammatory properties. And turmeric also is very good for arthritis. So it's a good thing to add. Some people even take turmeric pills, but if you do, make sure it's not just the powder, that it actually has some oil in it. And willow bark is another natural ingredient that is anti-inflammatory, and it's actually what aspirin was made from originally. And that can be very good for headaches, as well as using peppermint oil topically. And if you do that, put it right at this area. And ginger or ginger tea is another anti-inflammatory that is very good for headaches, especially migraines. Migraines usually come with some form of nausea or vomiting, and the ginger tea or just eating ginger can be very helpful for those. So those are some things you can remember to add to your diet if you do have the migraine headaches or any kind of headache. Now, a lot of headaches come from, as we said, computer use, but also stress. So it's good to develop a meditation practice or use some pranayama to just, meditation and pranayama can help you overcome your pain. So if you are having a headache, any kind of headache, if you can practice a pranayama, even the simple just alternate breath, do 4 or 5 of those. Just calm yourself down, get into that meditative state. And that can really be very helpful for any kind of pain. You're not identifying with your body. Swami Kriyananda used to go to the dentist and he wouldn't have Novocaine. And I hate to go to the dentist, so it's hard for me to imagine going there and if I have a problem not having Novocaine. But he used to have his dental work without Novocaine. And he said he would go beyond the pain. He would meditate, or he would even just go into the pain. And so if you're prone to headache, pain, I suggest you try to do some pranayama. If you're a Kriya Bond, you could do some Kriyas and see if you can get yourself to a different space, a different level of consciousness, because you will go beyond your pain. And that goes for any kind of pain. And so that is good to practice. So there is, I want to go into the points that we can use for the migraines. And at the back of the head here, right here, and you can put your hands here, right where the medulla oblongata is, and there's an indentation there. And you can put your hands down now, but that right behind that indentation is a blood vessel called the Circle of Willis. And it's actually a blood vessel that's like a circle. That blood vessel sends blood up to the brain, and the blood from the neck comes up to that circle. And that circle, the blood vessels feed the brain and the head and the temples. So it's very important not to have constriction there. And if you know the energization exercises, you know that we have the medulla oblongata exercise. And I suggest if you have a headache, you could start with the skull tapping, waking up the brain cells, giving some stimulation to the brain. You can do this with me. And scalp massage, just to massage your scalp all over. And don't just put your fingers on there, really press deep. They say if we age, our skin on our head, our scalp shrinks. So no wonder you can get headaches. Now, let's also practice the medulla exercise. Put your hands right here at the back of the head in that indentation and rotate to the right and then rotate to the left. And then inhale and bring your head back and exhale, chin to the chest. Now let's do that one more time. Rotate right, rotate left. Inhale, exhale, chin to the chest. Now, when we inhale, we're actually putting a little pressure on that circle of Willis, that circle of blood vessel that's right back there, and we're compressing it. But then when we bring the chin to the chest, it lets go of that compression, and then more blood flow gets up into the brain. So I suggest you do the energization exercise, that part of it, if you have a headache. Or even if your brain is foggy, you're trying to work on the computer and your brain feels like it's kind of foggy, just do that to get more blood flow up into your head. So now I want to go over some acupressure points that are good for us. Oh, one more point I wanted to talk about was caffeine. So for some people, caffeine can help their headaches, and others, it can cause more headaches. And it seems that if you drink too much coffee, it's not good for your headaches. But if you're not a coffee drinker or you hardly ever drink it, if you have a cup of coffee, the caffeine in the coffee can actually can help a headache, especially a migraine. So if you are a headache person and you don't drink coffee, you could try it. It could be medicine. So there are many acupressure points that we use for headaches. And the first one, it's commonly known, is it's called large intestine 4, and we call it Hagu. Now, in our body, there are energy channels called meridian going top to bottom of the body, and they usually are named after different organ systems. But this famous point is called Hagu, large intestine 4, is between your thumb and index finger, right in here. And I want you to take your index finger of your other hand and press on this, we call the web of the hand here. And press down hard, and then make a circle. And then let up, and then press again, and just hold. And let up, and then press and make a circle. And let up. So you can do that 3 or 4 times. That point is a famous point for headaches, and it's very good for temple and forehead headaches. It's also good if you go to the dentist and if you have a toothache, or you even have dental pain, you could do that. Or if you want to practice like Swami and not have Novocaine, you can press on that point. So it's a very good point to know. It also helps your immune system. So even pressing on that point and circulating the energy there will make a stronger immune system. Now, the next point is on an energy channel called the gallbladder channel, which comes up the side of the body, and it comes up the back of the neck and comes all the way forward here to the forehead, goes back again, and then comes up to the ear here. So that energy channel goes all over the whole head. So there is a point at the base of the neck, right? Now go back to that medulla, that place, and then take your hands and slide your thumbs down and move them out just a little bit. You'll feel 2 bones, and you want to come in from the bone and then press in and up, kind of right under the skull. And that point there is really good to release headache and neck pain. And actually, it feels good just to press it. Now, if you want to get an even stronger reaction, press up and then tuck your chin in and keep pressing up. And then lift your head back up. So let's do that one more time. So take your finger there, and you can make a little circle with it, but then press up and then tuck your chin down. Now we call that point gallbladder 20, but it's very good for cervogenic headaches that come from the back of the neck all the way up to the forehead, or any kind of headache. There's one more point on the gallbladder channel that's on the top of your shoulder. And so take your hand there and then just move your finger over, try to find that top place. And if you press down, the best way to find an acupressure point is it's a little tender. So move your finger around to find that tender spot. It's right between the shoulder and the neck. And then just press down really hard. That's a strong point. And let's go to the other side. So this is a very powerful point to release the trapezius muscle, which is in the back of its back. It's like a cape, and it releases the muscle tension. That point is kind of unique because when a woman's in labor, you can actually, for acupuncture, I could put a needle in that point, and it helps the baby come out. So it's kind of amazing point. Also, you usually don't put a needle in that point when someone is seated because of the strong stimulation, they could faint. Now, if you just put the pressure with your hand, that's not going to happen. You won't faint. But using the acupuncture needle, that could happen. And it's a very powerful point. If it can help the baby move through the channel and come out, it's very powerful. But it's very powerful to get rid of the tension in the upper back and neck as well. And that's this one's gallbladder 20, and this is gallbladder 21. There's one more point on the gallbladder channel. So let's find the top of our ear and then just go up just a little bit. I would say 2 inches in centimeters. I'm not sure how far. Go up and then use your middle and index finger and just press in and make a circle there. And this point is good for temple headaches, migraine headaches, and it's very good. And then come over a little bit in. This is right at the corner of your eye, and you'll feel an indentation there. You want to press there and just press and hold. Close your eyes and just press and hold. Now let go. Let's do it one more time. Press and hold. And let go. And then there are a couple more points. This one I actually like to do is you can take your thumbs right here, or you can use your index finger right where the eyebrows meet, and you just want to press in and up along the occipital ridge here. I think I like my index fingers better. But right, you're going to press your eyebrows up. You're right on the top of the ridge there. Let's do that again. Start in the middle. And that can be very helpful too. So a lot of these points are in the head, but there is one point on your foot that's very good for migraine headaches. I'm not going to lift my foot up, but I'm going to use my hand to show you. So pretend this is your pinky toe and this is the other toe. You want to come right between your little toe and the other toe and just stick your finger in there. So if you have a temple headache, so this would be your foot, and you just come to the little toe and just press into that area there. And if you have a temple headache, that point will be sore. And that's also on that gallbladder channel, and it can be very, very helpful. Oh, and I just thought of one more point for your neck. So you'll take your hand and you'll take the index finger of this hand. Now remember, this one's for the headache, and then you come in between the next 2 fingers, go over the knuckle into that little indentation. And this one is for your neck, okay? So you're going to press on that, and as you press on it, I want you to turn your head left and right. Now let's try the other side. You might be tighter on the other side. Between the index and middle finger, press down. And that will loosen any tension in the neck. And that's an important point. And then there's one more thing for the neck. Now, I want you just to rotate your head to one side. And then I want you to look left and right with your eyes. Now let's go back to center and turn to the other side and move left and right with your eyes. Now on this side, I can feel it. On the right, my neck is tight. So when I move my eyes to the right, I can feel it in my neck. But this will release the tension in your neck. It also makes me realize when we stare at the computer all day and we just look, that builds up tension. It's not only in our head, but in the back of our neck too. So when you're on the computer, make sure you take breaks and take time away from the computer. And how can we go beyond our pain? As I said a little earlier, if you know pranayama, do some pranayama breathing techniques. I would do those, before I tried to go into meditation. And then if you could do pranayama for a while and then move into meditation, or if you know your kriya, move into your kriya. See if you can go beyond identifying with the body. Try to identify more with your your soul nature, go beyond the body. And that can be helpful for any kind of pain that you have. Well, thank you, everyone, for being with me this evening. It was a pleasure.